Hospitals in central Sulawesi are struggling to cope following the earthquake and tsunami. Many patients have to wait in stiflingly hot tents with limited medical equipment to treat them. Most of the doctors and nurses are gone. This is one of the largest hospitals in Palu and is operating with around 10% of its original staff.
We're trying to call the staff to get them to come back. Then we'll be able to identify who's still here, who left and who we lost to the disaster.
The damage shows what the medical workers had to deal with on the night of the disaster.
It's thought there are around 30 people still unaccounted for inside this building, including hospital staff and patients. There are so many bodies still buried in mud and beneath rubble around the disaster areas that it's increasingly becoming a health concern, particularly for the search teams.
Handling the decomposing bodies and body parts exposes the recovery workers to diseases such as tuberculosis and cholera. The disaster has also left more than 60,000 homeless. Many are living in the open where rubbish is not being collected and there are no toilets. Doctors say they're starting to see an increase in diarrhoea and skin rashes.
The primary health clinic is not working optimally right now, so it is still supported by the volunteers. However, the volunteers is limited here, so it's kind of we have to educate people to go to the clinic or any medical team that provide the health care.
There's a constant risk of survivors suffering injuries, so free tetanus shots are being given. Many people spend their days making dangerous treks across the rubble and debris to where they used to live. More than a week on, the scale of this disaster is still emerging and the number of casualties continues to grow. The many potential health risks could make the crisis even worse. Wayne Hay, Al Jazeera, Palu, Indonesia.